Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
Postural alignment, movement, and sensory integration all have one thing in common. They begin in the foot. Yet, beyond wearing fashionable shoes, we tend to give our feet little thought. What do we need to know about the lowly foot that may well affect our health and longevity? Mission Evolution Radio TV show is coming to you around the world on the Voice of Canada Broadcast Network, www.vocbn.ca. With us this hour to explore the hidden functions of the foot is Dr. Emily Splichal. Dr. Splichal is a functional podiatrist, human movement specialist, the founder of EBFA Global, creator of the Barefoot Training Specialist Certification, author of Barefoot Strong, and CEO founder of Naboso Technology. With over 20 years in the fitness industry, Dr. Splichal has dedicated her medical career towards studying postural alignment and human movement as it relates to barefoot science and foot-to-core integration and sensory integration. Her website, dremilysplichal.com. Dr. Splichal, thank you so much for joining us on Mission Evolution.
Of course. Thank you so much. It is a pleasure as always.
It is a pleasure. We've had you on before, and it was wonderful. I think what you're bringing is, it seems so obvious, and at the same time, it's like so forgotten or never known, right? So, what is a functional podiatrist?
Absolutely. So a functional podiatrist goes through the same training as a traditional podiatrist, but as a functional podiatrist, I take a deep approach to the integrated function of the foot with the rest of the body. There is a powerful connection between your feet, your core, diaphragm, into your hips. So I'm really appreciating that. I also factor in functional movement. So I do a gait assessment on every patient. And then I also bring in functional medicine principles. So I look at stress, sleep, diet, inflammation, and I try to incorporate as many alternative methods as possible. Most patients who see me as a functional podiatrist really are not in favor of traditional pharmaceutical, surgical, Western medicine approaches. They want that more functional Eastern philosophy tied into their care.
So it's like a holistic approach where you're looking at the entire being rather than the big toe.
Absolutely.
So, what drew you to the field of functional podiatry?
I mean, I've always been uniquely interested in anti-aging medicine, which is now actually called longevity medicine. So they've actually renamed that category or that specialty. I remember being 16 years old and my mom getting us vitamins for Christmas. So I was very into vitamins and supplementation and health. I've been a member of the American Academy of Anti-Aging Medicine since I was a medical student. So that was over 15 years ago. And then I bring that philosophy again into my care. I know that there's a lot more to the feet than just the feet. We are actually treating a human being, and we have to treat the whole person and understand that there's a lot of emotional capacity or emotional complexity behind every presentation that a patient has.
It sounds intelligent. Go figure that, right? Instead of breaking us up into little pieces. So most of us think the feet is simply something to walk with. What are the less known functions of the feet?
So our feet can be thought of as a sensory gateway to the brain. There are thousands of nerves in the bottom of the feet. When you stimulate them, you actually wake up the brain. So by stimulating your feet, you can increase focus. So from a mental perspective, a cognition perspective, they have a powerful effect to how we ground or anchor, which means we have a mood or emotional effect. By just grounding and stimulating your feet, you can become connected with your body, connected with yourself. That translates to self-confidence. And then, of course, from just a movement postural foundation, it ties into stability, it ties into power. So there's a lot of aspects to the human foot. But for the listeners, I think just thinking mood, memory, and movement really encompasses the power of the human foot.
It's just pretty impressive, the many roles it plays that most of us are totally unaware of. How much does the footwear of the normal Westerner impact the feet, and in what way?
Yeah, so if we think of traditional footwear is going to be supportive, thick, typically more structured. So a thick cushion structured shoe is taking away a lot of the sensory stimulation that we need for our feet. It restricts and takes away a lot of the natural strength and stability that the foot can provide for itself. It actually limits how your foot connects to the rest of the body, which was everything I just described, mood, memory, movement. So if you don't get that movement, if you don't get that sensory stimulation, your nervous system starts to figure out how to function with half of the information at which it was designed to use. That creates compensation patterns, it creates injuries, decreases performance. So, if you're really trying to optimize what it is to be a fully functioning human being with your optimal potential, natural foot function is inherently part of that.
Well, a lot of us like to run, and running barefoot probably isn't real comfortable. What's the alternative?
So you totally don't have to run barefoot. Some people do. You don't have to. You could wear minimal shoes. You could wear transitional shoes. So there's a whole category within the footwear space that is minimal shoes and transitional shoes. They typically will have less of a drop, so they'll be flatter. They will have less cushion. They will be flexible, so you can twist the shoe like a rag or kind of a rope. And then they have a wide toe box. So all of those features can start to be incorporated into more minimal or natural footwear, allowing you to run with less support and cushion to then activate and optimize the natural function of the foot. You totally don't have to go completely barefoot, and that's an important point to make. That's very intimidating to people. You don't have to do that.
So, what are the soles made out of in the shoes that you're recommending for running? Because if we're going to ground, it doesn't make sense to have rubber soles or things like that. I mean, you're not going to be able to ground through that, are you?
Well, so most shoes are made of rubber outsoles. And the reason is that the rubber outsole provides the traction and the wear and tear that occurs from running, walking, pickleball, tennis, different activities that you're playing. You have to have a sole that's going to last long enough, which is why most of them are rubber. But you're correct. As soon as you put rubber between your foot and the ground, you take away the earthing grounding effect of being on your feet. To utilize that, you would have to tap into leather soles. So if you use a leather sole, you will then be able to actually ground or earth while wearing footwear. The way that I look at it is understanding the time and the place for both of them, right? Maybe in your day to day, right? Whatever your day activities are, going to work, etc. Could you use a leather soled shoe? That is one that allows the grounding. If you're doing something like a pickleball, tennis, running, okay, it makes sense to use a rubber sole, understand how that fits into the lifestyle.
So, what about the insulating your feet from the direct contact with whatever you're walking on?
Mhm.
Does that impinge your ability to stimulate the nerves at the bottom of the feet?
It does. All footwear, even the most minimal footwear, will take away some of the sensory stimulation. Honestly, that's part of why I developed my company Naboso, is because I was seeing that all these shoes had cushion, rubber, just an inner sole, outsole that was taking away sensory stimulation. So Naboso has a textured insole that you put into the shoe. So if you can bring sensory stimulation into the shoe and you're essentially offsetting the reality that shoes inherently disconnect you from the ground. How do you stay connected? You bring sensory into the shoe while you have this outsole that disconnects you. And then you work together. Then, when you can, as much as possible, take your shoes off, be completely barefoot around your home, be completely barefoot. If you could work out completely barefoot, that's great.
So there's shoes like maybe I can't mention names. They wear them a lot in the hospitals. They're big and ugly, but
Mhm.
they've got all these little pokies in the bottom of the inside of the shoe. Is that what you're talking about?
As far as stimulation, sure, it could be
Hmm.
that. Naboso is very specific. It's a patented texture that we use. That is a way to do it. There's other great ways to bring sensory stimulation to your feet when you are not in the shoe. One is whole body vibration. I absolutely love vibration training. Bringing vibration to the nerves in the bottom of the feet wakes up the muscles, stimulates circulation, which is great, builds bone density. So there's all these great benefits of what do you do when you're not in your shoes? And that's how you could think about offsetting the effect of wearing footwear.
So explain to us a little bit more about the vibration thing.
Mhm. Yep. So vibration is one of the most important sensory stimulation that we as human beings encounter every day. In fact, our cells communicate to each other through vibration. So vibration is very innate to being human. Vibration is experienced every time we take a step and our foot strikes the ground. Ground reaction forces are perceived as vibration. Vibration goes through the foot into the nervous system, stimulates our muscles to contract, which strengthens them, stimulates our bones to increase bone density. So that vibration can be experienced through walking, walking without shoes with cushion. If you have cushion in your shoe, the cushion will take away the vibration. But we need the vibration to stimulate our nervous system, our muscles, and our bones, right? So to offset that, you could also use whole body vibration platforms. They're platforms that look like a almost like an aerobic step size, and they vibrate and they bring in a very specific frequency of vibration. If I say the frequency, it might not mean anything, but it's between 30 and 55 hertz of a frequency into your nervous system. And the way that I tell my patients is that vibration from the ground is set at a frequency almost like music, right? Like when you turn a radio, you're turning to a different frequency, and that's how you capture the station, right? Same thing here. We dial in the frequency of the vibration so your nervous system tunes into it. Very similar. I love vibration. I think that everybody should incorporate vibration into their lifestyle as far as how to really connect to our foundation, the feet, the ground, and the nervous system.
Do you are you familiar with meridians and pressure points and all that fun stuff
Mhm.
as well?
Yeah.
So how do they fit in here?
So those are, I'm not trained in traditional reflexology. That is part of where people will focus on the foot, that there's different reflexology points where some points on the bottom of the foot correlate to different organs within the body. I'm not trained in that. However, I've spent a lot of time in Asia, so I'm highly appreciative of Eastern medicine and reflexology, and it's something that I do think and I embrace. There is then also different chi lines and meridian lines, which I also appreciate. I look more as a fascial line versus a meridian line. A fascial line is a little bit different. That is how you can connect the connective tissue from your foot into the rest of your body. Your feet connect to your core, to your
Well,
diaphragm, to your tongue.
we're going to have to pick up on all this on the other side of a station break. Dr. Spickle and I will return very shortly, so don't you go away. This is Mission Evolution, missionevolution.org. Is there more to the foot than meets the eye? With us this hour discussing the importance of foot health is author of Barefoot Strong, Dr. Emily Spickle. Her website, dremilyspickle.com. Dr. Emily, this is a different A little different topic here, but what about foot surgery? It seems like it's been around for a long time, and I personally haven't seen much success. But what's your experience of it, and what's your opinion of it?
Yes, so I was actually trained as a surgeon. I am a US based podiatrist, and the way that podiatry is in the United States is that we have to be trained as surgeons. So after podiatry school, we go through a 3-year surgical residency. It
Oh
is
my.
required to get licensed. So I have to become it. And then I did surgery for 5 years out of residency. I happen to, again, my authentic self is much more towards functional movement, functional medicine, regenerative medicine, longevity medicine. So that whole category in 2017, I actually shifted away from surgery after doing it for 5 years. And then my practice is now entirely built around functional and regenerative podiatry. So I have experience in it. I was trained. I understand the way that a surgeon thinks because I was taught that way. And I that's why I understand when a patient comes to me and they saw a surgeon and they said the only thing that will help you is surgery, why they thought that way, because that's what's in their toolbox. I think that it is important for providers to have more tools in their toolbox, or for the patient and for the individual to understand possibly the importance of specialization and then the role that each provider plays within the medical healthcare system, right? There's a time and place for surgery. Although I have many, many patients who refuse to have surgery, and I have to give them an option. I have to understand how can I achieve as much functional foot health as possible, knowing that that individual does not want to have bunion surgery, does not want to have hammer toe surgery or neuroma surgery or flat foot surgery or whatever it is. I have to be able to give them options still. So similar to when I get asked about orthotics, there's a time and place, but we have to understand the role and then what are the alternatives.
So, when you're anytime you have surgery, anytime you cut into the body, you're ending up with scar tissue, and scar tissue can be insidious. Have you found that people have secondary problems with their feet as a result of the scar tissue from the surgery?
Absolutely. So everyone's scar is a little bit different. Actually, some patients that I've seen and that I've had even when I was doing surgery can have a completely unexpected reaction to the sutures or to the stitches that are deep in the layers. And then the body will start to kind of spit it out. And then the incision just starts to open up. And now they have a whole, maybe they're dealing with an infection they didn't expect. Maybe because the body started to spit out these sutures, there's a chaotic healing response. We'll call it scar tissue. But this scar tissue response, even deep within the layers of the fascia that exceed just the superficial skin that you're seeing. So, yes, you can absolutely have unexpected, more complicated reactions to the healing that create complex scars. All scars, I feel, should be addressed, even the most minimal scars, because there's some great research showing that scars can trap nerves, sensory nerves, and motor nerves that then create compensation patterns. And it can actually inhibit the muscle that is underneath. And then that individual has this compensation pattern and they don't know what's feeding it. And it's actually the scar that's feeding it.
That's fascinating. So, when you do have to go to surgery, given what you know as far as functional podiatry goes, have you
Mhm.
developed or do you know of some rehab procedures that take into consideration all the factors that you have learned?
Absolutely. So when I guide a patient through surgery or the surgical recovery, I'm thinking about at what point can I start to stimulate the nervous system as soon as possible? Can we stimulate the bottom of the foot, even if the surgery is a little bit higher on the foot or it's in the ankle? Can we still stimulate the bottom of the foot? Could we stimulate around the scar so you can use little vibration massagers and stimulate around the scar? Could you just do some massage? Could you do different techniques around it? Then, after that, can you start to wake up the muscles? How do you incorporate the foot? Depending on how long the individual is non weight bearing, some surgeries have patients non weight bearing for almost 2 months. I've seen
Mm.
some go further than that, which means That could be 2 to 3 months without weight bearing on the leg. And then suddenly they start weight bearing on the leg again. And we have to reincorporate those muscles and those patterns again. So I very much believe in a post surgical rehab, if you want to call it, or a functional exercise approach.
How common is that?
Not very,
I was
sadly.
wondering. Hmm.
Sadly. Um, it's unfortunate that it's not the side that is taught within podiatry schools specifically. We are taught to be the expert in the surgical technique itself. And then the other side is, just kind of downplayed, unfortunately. My specialty, because I see the patients after, I get to see the effect on the system if it's not reincorporated the right way. I've seen chronic compensation patterns, and the patient doesn't know what they don't know. So we can't rely on the patient to take it upon themselves to know that they need a post surgical rehab unless they're guided towards that.
So you mentioned, well, what they use, inserts. Okay,
Mhm.
um, but is the problem in the foot when they use inserts, or is it maybe in the hips and they use inserts to equal out the legs?
Could be either. Could be either.
Okay.
So part of what my job or any functional podiatrist's job is to determine, is what this individual is presenting with a bottom up issue or a top down. It could be either, because both influence it. The hips and the pelvis and the pelvic floor and all of the muscles that wrap around our pelvis influence all the way down to the foot, and then vice versa. The foot strength, the foot alignment, the biomechanics, etc., feed up into the pelvis. So it could go both ways. And oftentimes that's the patient that I see, is that they've exhausted all these other providers and methods, and then now they're coming to me and saying, is it a from the ground up problem? Is it a bottom up problem that I haven't been thinking about? And sometimes, oftentimes I will say, yes, this is what you're presenting at your foundation. I could absolutely see how this is contributing to something in the hips and in the pelvis. But sometimes I actually rule it out and say, no, not what I'm seeing. I'm not seeing this as a bottom up, which means we got to look a little bit deeper into what's feeding the pelvis and causing that top down imbalance.
So if you have severe back pain, it could very easily be coming from your feet.
Oh, absolutely. Absolutely.
We don't think to look there, do we?
No.
So what are the pros and cons of foot surgery? When you
So some of the
choose.
Yeah. So let's take a bunion as an example. This is oftentimes one of the best examples because it's probably the most commonly performed foot surgery. A bunion is going to be a deviation of the big toe inward. It creates a bump on the inside of the foot. What happens when you have a bunion is you shift off of the cartilage. So now your joint is no longer aligned. As soon as you shift off of the cartilage, you predispose the joint to arthritis. So when I'm working with a patient and I'm looking at, let's say, a bunion and we're considering surgery, I always look at the joint health. I don't look at the cosmetics. Cosmetics is a different thing. I'm looking at, what is the joint health? Do they have pain in their joint? Are they showing signs and symptoms of progressive arthritis or the early signs of arthritis? And I will then have the discussion and say, okay, bunions are progressive. You cannot reverse a bunion without surgery. That's important to note. You cannot reverse or stop a bunion from progressing without surgery. So if we look at the foot right now, consider your age, consider the health of the joint, your activity, and the future of movement that you want to have. Is there an appropriateness for you to have surgery now to protect your joint health, to create better joint alignment so that you can keep moving and doing the things you love well into your 80s, 90s, etc.? That's the conversation that I have with the patient, versus I think what they're used to is they go into the provider's office, they see the x-ray or they see the bump, and they're like, oh, the only thing that will help you is surgery. There's nothing else you can do. You need to just have surgery. That's not empowering to a patient. It doesn't explain the thought process behind it. I want the patient to feel an ownership in the decision to have the bunion surgery or to have the surgery, which is why I just approach it from a different way. Even though both providers may think the best choice is surgery, I'm communicating it in a very different way to the patient.
Rather than dictating, you're giving them options.
Absolutely. Because at the end of the day, it's their choice, right? Everything is our choice with our body.
So, how does the way a person's feet hit the ground affect our overall health? Because I mean, we can start out one way, and then from a hip injury or bad shoes or whatever, it changes the way our feet touch the ground.
Yes. So I think that it's important to remember that part of what we experience every time our foot strikes the ground is ground reaction forces. And these ground reaction forces are our body's energy, right? It's force, it's stress to the body when you strike the ground. These forces are not a bad thing. They're used as your body's energy to take the next step. That's called potential energy. It's energy that your body will use to take the next step. It's how we move like a rubber band. And we are designed to move like rubber bands or like cats or like children that never get tired, right? They're really utilizing their myofascial connective tissue rubber band web of the body. Now, that whole story starts with the way your foot strikes the ground. And if you don't strike the ground the right way, meaning unstable, disconnected, with a lot of cushion between your foot and the ground, with too much support, you actually cannot utilize the energy from the ground to move efficiently. So oftentimes I find people are disconnected, a little bit destabilized, a little bit delayed, and they're inefficient in their movement pattern when they don't strike the ground the right way.
So we get less stable on our feet, if you will, as we age. What causes that?
A lot of it has to do with the nerves in our feet and our foot strength. And when I say foot strength, I'm actually talking about our toes. So your toes are very, very important to how we stabilize on the ground. There is something that is called toe flexor strength or an anchoring. Or you could think of it like gripping the ground. When you grip the ground, you anchor into the ground. That is how we maintain balance. That's also how we push off. So to create a lot of energy release at push off, you have to grip the ground as you're pushing. There's this opposition of force. As we lose that strength, which is part of hammer toes, bunions, atrophy of the muscles in our feet. We don't feel our feet because we have neuropathy. There's a lot of things that can happen. You have lots of cushion in your shoes. So you create all this disconnected weakening. Well, no wonder someone has an increased fall risk and loses their efficiency when they move.
Well, it's about time for us to take another station break. Dr. Spickle and I will return. So please stay right there. This is Mission Evolution, www.missionevolution.org. How healthy are your feet? This is Mission Evolution, missionevolution.org. Our guest this hour is Dr. Emily Spickle. Her website, dremilyspickle.com. Dr. Emily, if we start having our feet deteriorate, like we were just talking in the last segment, is there a way to turn that around no matter what your age?
There's a way to get a positive gain from stimulating your nervous system and waking up the muscles. Absolutely. Now, the degree, I can't guarantee that, But I think that based off of the power of neuroplasticity, the human movement system, the muscles, that there is this inherent plasticity to respond to stress within the body. That, yes, I do recommend that everyone, regardless of their age, injury, or disease level, that they are thinking about incorporating foot health.
So let's go back to the vibration thing. If you use one of those, they're like a little pad or something that you stand on that creates vibration. If you start using those when you're 85 years old, is that going to make a difference?
Absolutely. So the vibration platforms, they have research that you can sit in a chair. You could even sit in a wheelchair and put your feet on it and put your feet on the platform 10, 15 minutes. So it's going to vibrate. After 10, 15 minutes, you are waking up the muscles, the nervous system, the circulation. That is huge. A lot of people that are not ideally ambulatory, or maybe they're not ambulatory because of injury, disease, etc., or age, that they're not able to walk the amount that they ideally should be, we have to activate our circulatory pump. The vibration platforms mimic that circulatory pump, and they help get the blood from the feet back up to the heart, to the lungs, and all the way into the brain. That is very neuroprotective.
And so that you don't have to get up and do much of anything. Just sit there and vibrate your feet, and it's going to create an improvement.
Absolutely.
Not just in your feet, right? It's going to create throughout the
Whole
body.
system. Yeah.
Amazing. Okay. So, why do so many people have foot problems in the USA and Canada? It seems pretty prevalent here.
Yeah. I think it's because of the lack of awareness. And this is why I do the work that I do, and anyone within the space that is helping to bring an awareness to foot health is we don't know what we don't know. And I say this all the time, that the individual, my mom, I mean, my mom's a little different because I tell her everything, but an example of like my mom, right, is the neighbor, unless something is mainstream and spoken about a lot, or it is commonplace for a primary care provider to speak about it, for, mass media, for advertisements, pop culture, whatever it is, if it's not spoken about at that level, well, no wonder they don't know it. I know the level of what I do in this space because I specialized in it, right? So I think it's very important to have platforms that are advocating for the importance of foot health so that people know it's a priority. It's not just part of your body you slap into shoes and you never think about unless you have foot pain.
So, what are the other signs and symptoms that, outside of just foot pain or even back pain, that we've got a foot problem here? Because you were talking about how it affects circulation and everything. Is there some signs and symptoms that we can watch out for? It indicates it's the feet.
Sure. So it could be tingling and numbness in the feet. It could be swelling in the feet. Of course, pain is a common indicator. It could be a change in range of motion. So maybe you feel like your hips aren't moving as much. Maybe you're not walking as efficiently. Maybe you tire a little bit easily when you're walking. Maybe it has something to do with the whole mechanics of how you're walking. Of course, there's other things that you could look at, like the skin integrity. That's important. Your nail health. That's important. So there's a lot of factors that come into it.
If if you have problems going on with the nerves in your feet, what solution do you have for that? Like the tinglingness,
So
that sort of thing.
yes. So this is where it is important. Now, I actually believe that people should have an annual foot health check. There should be something as far as going to a podiatrist, maybe a functional podiatrist, and having just a foot health screen. Kind of like when people will go to their primary doctor and do an annual screen, and they'll just assess, do the blood work, how we doing, where we at, what could we catch early. If that was done, then if there was a little bit of tingling in the foot, that could be brought up earlier until it's so far past that they then kind of have to get shunted through all these specialists. So I think that that's an important part of it. Um, In the case of nerve health, there's things like vitamin supplementation that's really good. You can look at diet. You could look at the inflammation of the body. You could look at comorbidities. Is there diabetes? And the first sign is tingling in their feet? I don't know. Um, could we do things like texture and vibration to try to stimulate the nervous system? Then we can start to address it a little bit earlier. I'm a bigger fan of preventive medicine than reactive medicine.
So, some, if many of us have been in car accidents, if this is out of the next thing, we've had a spinal injury or something that had us changing our posture and walking differently. Does that filter down to the feet? And if it does, how do you get to filter back out?
Yes. The way that we carry the rest of our body will ultimately affect our feet. And like I said before, vice versa. So let's say we have a hip injury and we don't walk the same way, um, or something with the neck and the T spine. So when we walk, we're obviously taking 2 steps with every stride, is what it is, right? We step with our right leg, then we step with our left leg. The step that you take with your right leg should be mirrored or symmetrical, as close to symmetrical with your left leg. And every time we step with our right leg, our left upper body swings forward. So we create this counter rotation. Right leg steps forward, left arm swings forward. Left leg steps forward, right arm swings forward. This range of motion like this is really important to how we hydrate the body, and we bring mobility to the entire body from the tips of our toes to the top of our head. Is you have to be able to do this. One thing that I will often see to people is because of an injury, like you mentioned, maybe a car accident, a ankle sprain, an old sporting injury, whatever it is their right step is actually much shorter than their left step. So now they've been walking for 10 years with 2 different step lengths and 2 different rotations of the upper body. Well, no wonder they have chronic low back pain, right? So that's where you could start to see it. Now, to answer your question, as far as how would we correct it from the ground up, let's say, as an example, what if it was the range of motion in the big toe on their left foot? Let's say they had arthritis in the big toe on their left foot and no one ever looked. And that's why they're taking 2 different step lengths, right? So we have to be thinking whole body when we're looking at what could be contributing to the way that someone moves and how they carry that. Oftentimes people think of a podiatrist as a foot doctor, and that unless your issue is totally in your foot, I can't address it. And that can't be true, because your feet connect to everything else in your body. So if you have back pain, you should absolutely think to see a podiatrist. If your neck hurts, if your shoulder, even if you have carpal tunnel, it could be coming from your feet.
So if a person has like the injury you're saying, like a bunion or a foot that broke that didn't heal well, and they're unable to flex their foot to keep their gait even, what's the correction for that?
So it depends on what the presentation is. Maybe it's surgery. I don't know. I would go over that with the patient. It might be surgery. Maybe it's certain footwear can actually help accommodate and optimize the way that someone walks. And I go over that with a patient. One example would be rocker based shoes. A shoe that has a 4-foot rocker allows you to roll through the shoe without requiring the same range of motion and flexibility in your foot joints. So it could be very advantageous. Maybe it's a mobility fascial issue. So I do a lot of body work with the individual, maybe some stretching. I like to stretch thinking about fascial lines, so that the foot, hip, torso connect to each other. So I do total body stretches. So that's something that you could do.
So let's go back to the brain. You said something that just kind of caught my interest, is that foot health can actually affect the brain. How does it affect it, and what do we look for there?
Yeah, so that big one would really lie within the sensory stimulation. That would be the first one that I would address, the sensory stimulation. So the nerves in the bottom of the feet stimulate a part of the brain called the somatosensory cortex. That's in the neocortex. It sits around here. Somatosensory. Somatic means body, right? So it's your connection to your body externally. So my hands, eyes, joints, etc. And then I use that sensory information to control my posture and my movement. That's the somatosensory cortex in the brain. So if you do not stimulate your feet, you start to lose that connection of the brain to movement. And we were born to move. Our nervous system was designed to move. That's just inherent in who we are as human beings, as we are movement beings, right? So that's an important part of it. Touch and sensory stimulation is also calming. Touch is known as nature's natural analgesic. So it calms our nervous system. It helps keep people in a parasympathetic state or rest, digest, socialization state, which is very important. I believe that that's very important with a lot of the fun, chaotic stuff that is happening in the world today is we need to stay connected to ourselves. We need to stay grounded. We need to stay anchored and we need to stay parasympathetic. Very important. The last one that helps the brain goes back to movement, and it has to do with our ability to walk fast. When we walk fast enough, step, 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 rotating the torso, you activate this full body circulatory pump that drives blood to the brain and it stimulates what's called brain derived neural growth factor. Brain derived neural growth factor. Very important for the protective mechanism of the brain, the neuroplasticity and the longevity of the brain and brain health. You have to be stimulating brain derived neural growth factor. You need blood to do that. And that's part of that movement and that circulatory pump.
So you were talking about walking, walking slow, walking fast. What about running? If you compare running with walking or speed walking, what's
Mhm.
the best for the whole system?
Yeah, so totally different systems and mechanisms. I think depending on the age of the individual, um, walking may be friendlier. Running clearly is going to have higher impact forces, higher joint stress. So if you do not have the proper mechanics from the ground up, proper mechanics for running, I don't want someone to get injured trying to get this brain derived neural growth factor. Would they be better off just walking fast? Now, it doesn't mean you have to do legitimate speed walking or race walking. That's totally different. That's a different biomechanical pattern within the body, but could we just walk sufficiently fast? And the way that we know that we're walking sufficiently fast is that we fall into what's called momentum. And you will know this. It will suddenly feel like you are falling and catching yourself. What I used to tell my patients when I practiced in New York City is I would say, leave everything home, right? Leave it in your apartment or your home. You could take your phone if you need, put some music on if you want, but I just want you to walk and just feel what it feels like to move your arms, to take long steps, and to fall into this momentous state.
Well, we're
And
going to
it's
have to take another station break. Please stay with us as Dr. Spickle and I continue to explore functional podiatry. This is Mission Evolution, www.missionevolution.org. What happens when your feet let you down? This is Mission Evolution, missionevolution.org. We're continuing our discussion with Dr. Emily Spickle. Her website, dremilyspickle.com. Dr. Emily, let's talk about babies. I remember, originally, and I hope it's changing, that when a baby gets to the point that they're getting ready to be pushing them little selves up to stand, not even walking yet, they used to put these gag awful white shoes that had no flexibility whatsoever.
Yeah.
And of course, the child's always trying to take them off. So then you put those little gizmos on so they can't untie them. What impact did that have on our developing feet?
Yes. Oh my gosh. I'm a huge advocate of barefoot babies, barefoot toddlers. What I think is important to note is so this neuroplasticity, I used this word before. This is the challenging and the shaping and the expanding of your brain and your nervous system. So that means also your peripheral nervous system, your hands and your feet, right? So if you are in what's called your peak window of neuroplasticity, that is from the moment you are born until you are 4 years old. That is when you want to keep the sensory stimulation as high as possible, which means you, of course, do not want to put shoes on the feet of the child or of the toddler to try to optimize as much of this neuroplasticity as possible. That's also where you're really tracking motor pattern development, right? And I find it really interesting that most of the milestones that we are following in a newborn through these different phases of development are really motor based. And the motor based development of the child is an indicator of their cognitive development and even their emotional regulation. So there's this huge interplay between movement, memory, mood. So at that time, you do not want to have footwear, even socks. I say take the socks off of the baby so that they can get the stimulation, they can feel, they can touch, they can navigate, and they can really harness that inherent dexterity of the foot, which is just part of our nervous system.
And I love the way their little toes work and everything. And wouldn't it be
Mhm.
would it be ideal if we maintained that level of flexibility in our feet and our toes into adulthood? Can we do that?
Absolutely 100%. Get the shoes off, get the socks off, release your feet every day, go outside and ground or earth. Use things like toe spacers, use textured products, use vibration products, do yoga, do Pilates, do different barefoot workouts, and try to really harness and um, encompass that full natural function of the human foot.
So, what countries have the best foot health and why?
Haha. I've traveled all around the world. I've been to 35 countries, so I've seen many different cultural feats. Um, I don't know if there is one that is the most ideal. Obviously, I've seen a lot of the different Asian cultures. There's actually a lot of flat feet in Asian cultures, Southeast Asia, which is quite interesting. Sometimes we would think that they would have a different foot. More of a European foot is a little bit more higher arched. So it's, I think, inherently everyone has different foot problems, especially as they embrace Western culture. They want the footwear, right? They want to be in different athletic footwear. Maybe they're wearing high heels or different things that are disconnecting them from that natural foot function. Um, so I would say you would have to be as kind of off the grid to get as natural and ideal foot strength as possible.
I know I grew up in Saudi Arabia, and the natives there wore flip flops. That's what they
Mhm.
wore. Um, and how does something like that? It's close to barefoot, but it's insulated from the ground. How does something like flip flops affect the feet? Because you have to grip them to keep them moving. And
Yes, yes. So flip flops are interesting that people initially would look at them and say that they're flat. So, well, one, do we need support? That's often a debate if a flip flop is totally flat. The flatness of a flip flop doesn't bother me at all. Our foot is designed to support its arch and to load dynamically when we walk. Part of the flip flop that you alluded to is that it's not connected to your foot. So every time you take a step, you either have to grab the flip flop, you have to swing your leg around, you have to just slide your feet. You're going to change the way that you walk so that you don't lose the shoe. So, what I recommend to people if they want to be in a sandal flip flop is make sure that it is attached to your foot. If it is all the way attached to the ankle and to the foot, that means you can pick up your foot, you can run, you can do anything, and you don't have to subconsciously think about keeping the shoe on the foot. So that would be the one downside. And I know the weather may be getting warmer here soon. I'm in the desert, so it's always hot. But To wear something like a slide or a flip-flop or a Croc, right? Crocs are extremely popular now, is unfortunately people start to slide and shuffle. If you shuffle, you are not utilizing the ground to ground reaction forces. You're actually changing a lot of the mechanics and the co-activation pathways that are inherent to our nervous system. You actually take away hip extension. Hip extension is how you activate your glutes, and that's part of how you stabilize your pelvis and your lower back. So I actually see a lot of postural impact from shoes like Crocs where they're shuffling or they're sliding their feet.
And that same thing would go with mule slippers. If you wear slippers a
Mhm.
lot around the house,
Yep.
get something that attaches to your foot so you can pick your foot up.
Yep.
And okay,
Yep.
that makes sense. That makes sense. So something like the little, I don't like to mention brand names, but they're fabric slippers with leather soles, and you can throw them in your
Mhm.
washer, and they're real
Mhm.
soft. Is that preferable to a regular pair of slippers, say for instance?
Yep. Absolutely.
Yeah, I'm catching on. I'm catching on.
Good job.
So let's talk about high heels.
Okay.
Um, they've been around for a long time. And what's the impact of wearing high heels? I mean, it used to be I worked places where they required them. So
Mhm.
what do high heels do to the body and the feet?
Yes. Times have definitely changed as far as the high heels. We are now in a different culture. We're in an athleisure phase of style and fashion also, which is, I guess, a benefit to those who used to wear the high heels. But high heels are obviously putting the foot in this plant or flex position like this. What happens when we go up onto our toes is we actually rotate our hips. So people might not realize this, but as you lift your heel, your leg is rotating out, your hip is. So that causes a lot of external rotation. And then if you lock in like that, that causes your pelvis to tuck under. So essentially there's this chain of mechanics that move when you go into a high heel position. In addition, because you're up on your toes, well, now my center of gravity, so normally our center of gravity is in front of our in front of our body. It's not even in our body, it's in front of our body. So now I'm raising up and my center of gravity shifts forward. So what happens is we have to kind of shift, and the Jenga blocks get shifted out to try to maintain balance, right? How do we maintain our center of mass? We have to shift this way, this shifts this way, this shifts this way, right? That causes a lot of gravitational postural stress to the lower back, to the knees, to the neck, and then, of course, to the ankle and the big toe. So it can be very damaging. It's obviously an unnatural position. Men find it attractive, so that's why women started doing it. It is a power position for women, so that's why in a corporate setting, it wasn't just the feminization in the corporate setting. That was probably a certain era, but then it started to be associated with a power position for women, and women of power would wear it in a work setting or corporate setting. So it's quite interesting.
Well, you can always take it off and hit somebody over the head with it if they
Or
upset
that
you.
as
There's
well. There
that.
you
Yeah,
go.
there's that. So why is balance so important in movement? I mean, we've been talking about from the ground up, but then you were just talking about this business where
Mhm.
the we're stacked and then gravity is starting to pull on us in a different way, isn't it?
Yes.
So how does all that work together?
So what is very unique is our ability to walk. So just what makes humans unique from other animals is we stand on our 2 feet and we walk on 2 feet, right? That's very different. We walk on 2 feet very efficiently. We can walk fast on 2 feet. In order to walk fast, you have to be able to take long steps, right? I spoke about that a little bit as far as like walking speed and things like that. Walking with long steps requires you to stand on one leg. So, to walk fast, to take long steps, to walk the right way, the ideal way for longevity, you have to be able to balance on one leg. So it's a moment in time, right? During the gait cycle. So balance is at our foundation part of longevity. Balance is standing on one leg, right? When we stand on one leg, we have to feel our feet. So that's the sensory side of the feet. You have to have toes that can anchor or grip into the ground. So that's toe flexor strength. We have to have that. Your feet connect to your deep core muscles. That's the bottom up stability. And then your glutes have to activate. That's how you stand on one leg and you stabilize the knee as you're standing on that one leg. So there's a lot that comes into balance and how balance translates to walking.
So how does longevity fit in there?
This goes back to the circulatory pump, right? And the hydration of our system, the range of motion, really a lot of the stimulation of cognitive protection, emotional regulation, circulation through the system, right? Part of how you support and prevent disease comes from stasis. The more you can activate circulatory pumps, you're avoiding stasis in the body. You create the circulatory pump by walking fast enough. To walk fast enough, you have to take long steps. To take long steps, you have to balance on one leg.
Well, there you have it. So we're about out of time, so I don't want to miss out on asking you, Dr. Spickle, what's your mission?
My mission is to build an awareness and a prioritization of the importance of foot health in movement longevity, and really that trifecta of mood, memory, movement, and the role that plays in longevity.
It's hugely important. How far are you getting with that? I mean, it's kind of a new area, isn't it?
So I've been doing this and spreading this message for the last 15 years. So it is building every day. I try to do it through different books that I have, through podcasts, through interviews such as this, through my company Naboso, and then I educate other professionals in this philosophy. So there's more messengers out there than just me on this big message.
Well, thank you for doing it. I can certainly after having the hour with you, I can certainly see how important it is. So unfortunately, we are out of time. Dr. Spickle, thank you so much for coming on the show.
Thank you.
Our guest this hour has been Dr. Emily Spickle, the author of Barefoot Strong. To find out more about Dr. Spickle, where you can get her book, and all she has to offer, visit her website, dremilyspickle.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy our past archived episodes, visit www.missionevolution.org. But please be sure to join us right here next time on the Voice of Canada Broadcast Network, vocbn.ca, where this mission will continue, bringing information, resources, and support to our rapidly evolving world.